these tumors because they're so common, many women may be having them and may not even realize they have this problem because they may have no symptoms whatsoever. So as long as the young girl has hormones, she has periods, the fibroids keep on growing. So they're dependent on the hormones, which is why I said it's a disease of young women. Once you become menopausal, supposing you're 60 years old, periods have stopped, hormones have finished, then the fibroids don't really grow. Infertility is a part of a fibroid which is on the inner side. A fibroid which is lying on the outside may not affect fertility directly. So if a patient, for example, she can become pregnant even at 38, but there's a much higher risk of having babies with genetic problems such as Down syndrome. So we recommend that if you want to do egg freezing, try and do it before 35. So if you're able to freeze good number of embryos or eggs, the chances are very high of your having a pregnancy later. There are almost no risks with the technique.
Hello, my name is Karishma Shah. I'm a clinical nutritionist. I'm here with a very, very special guest today. We have Dr. Rishma Pai with us today. Dr. Rishma Pai is the only gynac in the country to have headed as president of all the gynecology federations, such as the Federation of India, which has more than 40,000 members in it. She is also the president of the IVF Society of India. She is the president of the Endoscopy Society of India. And she's currently the president of the Mumbai OB and Gynac Society of India. She is also a leading gynac and OB who has worked with the leading hospitals such as Leelavati, Hinduja, and Jaslok. She is also a fibroid treatment specialist. So, Doctor, thank you so much today for being a part of this conversation. We are more than exhilarated to have you with us today.
Thank you so much. A pleasure is all mine. Thank you.
There are lots of young women today who have so many questions regarding, a lot of burning topics as far as, their, pregnancy is concerned, certain infertility treatments are concerned, there's a lot of misinformation out there. So, which is why today we've come up and we founded some very interesting questions to ask you so that, you can give us your expert advice on these topics and, all these girls can get the kind of information that they're looking for.
Sure.
So, Doctor, the first question for today is, what exactly are fibroids? And, how does the patient know that she has this condition and if it can reoccur?
Yes. So let's start by saying that fibroids are very commonly found tumors of the uterus or the womb. 20% of young women have fibroids. So it's a disease of young women. And these are solid tumors, usually not cancerous, especially in the younger group. They don't turn cancerous very often. But if a 50-year-old, 60-year-old has fibroids, they can or more often will turn cancerous. So these tumors because they're so common, many women may be having them and may not even realize they have this problem because they may have no symptoms whatsoever. However, when the fibroid is, there are different types of fibroids in terms of location. So if this is the womb, for example, or this is the uterus, there can be fibroids sitting on the outside, which we call serosal fibroids. They usually cause no problems at all unless they become very big. And we've operated fibroids as big as a watermelon or more. And those kind of fibroids, obviously, they'll cause a big, the stomach will start bulging. They'll feel something hard when they press their abdomen. And there may be a lot of pressure on the urine or the bladder, area. And they may say they want to go to the bathroom very often or passing, or it may press on the rectum and they may have changes in their pattern of passing stools. So these are the very big tumors which lie outside. There can also be fibroids which are lying on the inner part of the uterus. Supposing this is your uterus, on the inner side when they lie here, even a small fibroid can cause a lot of problems. And these are the main sort of symptomatic or problematic fibroids, which are the submucous fibroids. They lie where the baby is supposed to sit in the inner part, with the part where bleeding happens, where the periods come from, that inner part. And even if a small fibroid grows there, it can cause heavy bleeding, irregular bleeding, difficulty in becoming pregnant. And if there is a pregnancy, there can be an abortion or a premature delivery. So the main problematic fibroids are the ones which lie on the inner side, but all fibroids after a certain size, when they grow big, or there are many, we've seen patients with 20, 30 fibroids in the uterus. And so obviously then they start causing all these problems which I mentioned.
Yes. Thank you for that information, doctor. And what are the leading causes of fibroids? Can they be prevented in a certain case?
Unfortunately, nobody really knows why fibroids occur. Just like many other diseases, why does it happen to her and why does it not happen to the next person? So there can be a small component of genetics, like supposing the mother has fibroids, there's a little higher chance of the daughter getting it. Not like everybody, but a little higher chance. Secondly, these are hormone dependent tumors. So as long as the young girl has hormones, she has periods, the fibroids keep on growing. So they're dependent on the hormones, which is why I said it's a disease of young women. Once you become menopausal, supposing you're 60 years old, periods have stopped, hormones have finished, then the fibroids don't really grow. So why it happens, one doesn't really know. And unfortunately, there's really nothing you can do to prevent them from happening. So all this internet information about eat this and do this, none of them are going to prevent fibroids. The only advice is that because these happen in young women, and sometimes you may not know that you have them till a late stage, it may be a good idea for every lady, and I say this all the time, to go for regular gynecological checkup. So you should have a gynac. People in India believe that only if you're going to have a baby, you need to go to a gynac. That's not true. You should have a gynac of your own, somebody whom you trust, someone whom you can talk to for your normal day-to-day problems. If you're having little white discharge, you have some itching, you have urine burning, you have stomach pain, you have heavy bleeding, any problem, you need to have a gynecologist. So if you go to your regular gynecologist for a regular checkup, even an internal checkup will tell you that you have fibroids, or a simple sonography, which is now available everywhere. In every corner, you have a sonography clinic. Sonography will tell you that there are fibroids in the uterus. So a normal uterus, if you go to see, is this size. This is the size. One fist is the size, like a pear. The fibroid is exactly like one pear, like a fruit. And that's the size. But with the fibroids, it can become so big that sometimes we say it's like a 5-month pregnancy or a 6-month pregnancy. That is the size the fibroids go to. Yeah.
Okay. And doctor, with the fibroid condition, does it, having fibroids, does it affect pregnancy or infertility rates among women?
Yes, definitely. Fibroids, depending on their location, their size, their number, can surely have an impact on the patient either becoming pregnant, or if she's becoming pregnant, then result in miscarriages or, like I said, preterm deliveries. So supposing there is a small fibroid on the inner side of the uterus, like I said, a submucous fibroid, it will act like a, copperty, like people, if they don't want a baby, they put a copperty inside. So this fibroid acts like a copperty, doesn't let a baby sit inside, because you'll be surprised to know that inside the womb, where the baby actually sits, the space is very little. 1 teaspoon, that is the amount of space that is there actually inside. So if there's a 1 teaspoon space, and in that little space, a tumor like this is growing, it's filling up the entire space. So there's no place left over. So infertility is a part of a fibroid, which is on the inner side. A fibroid which is lying on the outside may not affect fertility directly. So it all depends on, so it's not like, oh my God, I have a fibroid, what will I do? It's not like that. You may have a fibroid and nothing needs to be done. You may have a fibroid, we may give you medical treatment, but certain fibroids will need surgical treatment. And now, luckily for the young ladies out there, almost, I would say 99% of fibroids are treated by keyhole surgery or buttonhole surgery or laparoscopic surgery. So essentially, it is like the cut on the stomach is like literally 0.5 centimeter. Very tiny. This is the size of the cut. And through that, we can put in a camera, we can put all the different instruments, and we can actually, even lasers, whatever it is that you want. And with these tiny cuts, just one stitch on the stomach, you can actually remove such big fibroids. So it's now very, very amazing the kind of surgery you can do through this endoscopy or laparoscopy route. So, many of these fibroids need to be removed, but all fibroids do not need to be removed.
That is very interesting information, doctor. Thank you for that. On the topic of infertility, what are certain factors that kind of, make a woman a candidate to go in for infertility treatments usually?
Yes. So let's start by saying that any couple who is trying for a baby for about 1 year and not becoming pregnant, they need to go and seek some kind of advice from the doctor, from the gynecologist. Because 10% of couples, even though they don't have any problem, so to say, will experience difficulty in becoming pregnant. The problem could be 50% with the husband. The sperm count may be low, or the movement of the sperms may be less, or there may be even zero sperms. And unless you test the semen sample, you will not know it. So 50% of the time, the husband has some problem with the semen count, and 50% of the time the lady may have some problem, and the problem could be in the ovaries where the egg comes out. So every month the egg may not come out, or there could be a problem with the tubes. Both the fallopian tubes may be blocked, so the egg has to come out from the ovaries, go through the tubes, and then come into the uterus. So if the tubes are blocked, the egg cannot come inside the womb. And obviously, if there are tumors like fibroids inside the uterus, it will not allow the pregnancy to sit. There can be many diseases like endometriosis, again, a very common disease in young women, which can be very negative for pregnancy. And nowadays, we are seeing many, even young girls going into what we call premature ovarian insufficiency or premature ovarian failure. What is this? Very commonly, we are seeing a girl, for example, 28 years old or 30 years old, she's married for 2-3 years. She doesn't want to have a baby. She comes to me and she says, doctor, I want to have a baby after 2-3 years. I say, okay, fine, no problem. Let's just do some check. And we'll just do a simple blood test, or we'll do a simple sonography. And we'll find out that this girl's eggs are almost finishing. And it's a surprising thing because she's quite young. So many girls nowadays, because of maybe, we don't know the reason, environment, the toxic foods that we are eating, the hormonal changes, the eggs are becoming very less. And so if I were to see a girl like this, I'll immediately advise her that, what, you may want to postpone pregnancy, but your eggs are becoming very less. So you better plan your pregnancy early. So essentially, when they come to us for inability to have a child, then we do all these tests. We do basic blood tests, we do sonography, we may do an X-ray of the uterus. And once in a while, we may do this laparoscopy, put a camera inside, see the uterus from outside, from inside, and then we can tell you exactly what the problem is. But just looking at the face of a person, nobody knows what is happening inside, So once you do the test, then you find out what the problem is. And depending on the problem, treatments are completely different. Treatment may be just advice that, okay, these are the fertile days in a menstrual cycle, 15th day from the 14th day from the period is a good time, try relations at that time. Or it may be tablets, or it may be injections, it may be simple insemination, or once in a while we will suggest even in vitro fertilization or IVF. So it all depends on the problem that the woman or the man is facing.
Yes. On the same note, doctor, with the plethora of information that you just shared right now, what is an advice that you would like to give to young girls and boys, married couples, to kind of, in regards with fertility? What is it that you would like to tell them?
Yes. In India, unfortunately, we don't have a custom of, if a couple is, for example, engaged, they're going to be married, to come for counseling. I would actually very strongly suggest that if you are getting married, I would say before buying your wedding clothes and concentrating on your makeup and jewelry, make one appointment also with the doctor. So you make 10 appointments for your lehenga, but you don't make one appointment for the doctor. And that is most important, because before even marriage, or very early, as soon as you're married, very soon after that, if you visit your doctor, you can do what I suggest is like a reproductive planning. You plan your life. You may say, okay, I'm 25, for 5 years, I don't want a baby. Doctor, what is your advice? So then we'll give them the proper advice for not having a baby. If they say, doctor, we already, I'm already 30 years old, I've just got married, I want to have a baby very quickly, then we will test and advise accordingly. So there are many other things. For example, every couple should have basic tests. For example, the girl should have a rubella test. If she's not having immunity against rubella, we can take a vaccination. Nowadays in COVID times, everybody's talking about vaccinations, but there are many other important vaccinations which you should have. So rubella, we can test for thalassemia. Thalassemia is a very common problem in India, and you may not even know it. You just have little low hemoglobin and you say, oh, doctor, my hemoglobin is already low. Why is it low? When you test, you may find out that you have thalassemia. And if your husband also has a mild thalassemia, then you can have a baby with a severe life-threatening thalassemia. So a simple blood test will tell us, okay, no problem, don't worry. Or, oh my God, both of you have minor thalassemia. You better be careful when you have a baby. So there are many things which is to be planned from before. Once you're already pregnant or you're already, past that time, then there's nothing we can do. So many girls unfortunately become pregnant when they don't want a baby. Then they come for an abortion, which is also not the right way to go forward. It's better to plan it, right? So both ways, whether you want or you don't want a baby, whether you have a disease or you don't have a disease, what you want to plan, if you want contraception, all that advice, all that information should be shared, discussion should be done, and you should make an informed decision. Don't be blind, ho gaya to ho gaya, nahi ho gaya to nahi ho gaya. That is a very sort of a blind way of doing things. And I think every educated person at least must know their body. They must know their little bit planning of life, and they should go forward in that fashion. So which is my, in one line, the advice that, seek the consultation with an expert doctor early on, either before or soon after your marriage, so that you can plan nicely what it is that you want to go ahead with in terms of, family. That's very important. Yeah.
I think that is fantastic advice, doctor. I mean, I don't think anybody could have put it in a better way. What you have just said makes so much sense in every aspect of planning and later on with conception also, and how to deal with all these things also.
Yeah.
So thank you for that beautiful advice. Doctor, on the note of pregnancy and infertility, we're seeing a lot of different kind of IVF treatments, IUI treatments. There's egg freezing now that has started. So with all these various different infertility treatments, according to you and your advice, which one is more effective, or probably gives us a little bit more promise of pregnancy, and what are some of the risks involved, if there are any?
Yes. So let me start by saying that fertility treatments are now very, very standardized. For years, like for example, if you say IVF or test tube baby, it's a more than 40-year-old technique. So it's not a new thing which is just come, oh my God, it's an experiment and, something will go wrong. No, it's an old treatment, So it's a very standard treatment, and the treatment totally depends on what the problem is. For example, if a patient is totally normal, wife is 100% normal on the test that we do, husband is normal, yet they're not becoming pregnant. And you'll be surprised that more than 20% of couples look to be normal completely and still don't become pregnant. So if you have what we call unexplained infertility, or you have some little hormone problem like polycystic ovaries, egg is not coming out, periods are irregular, then a simple treatment with tablets and with insemination, IUI, what we call, the patient will have a good chance of becoming pregnant. So in IUI, what do? We just take the husband's semen, we wash it, prepare it, and with a small tube, very, very thin tube like a thread, we put it inside the uterus when the egg is coming out on the same day. So it's a very simple treatment. You come and do the treatment, you go home. Very simple, not expensive, but the results are also a little lesser. The results are less than 20% every time you try. So obviously, 2 or 3 times you have to try IUI. Supposing a patient comes whose tubes are both blocked. Now, if your tubes are blocked, for example, because of tuberculosis. In our country, TB is so common, So because of TB or some infection or some operation that she has had, tubes are both blocked. Or if the husband's sperm count is very, very low, or there are hardly any sperms in the semen sample, this lady is not going to become pregnant with any simple treatment. So why waste time? Why say, okay, theek hai, 6 mahina, try tablets, then it's a waste of time. So if you go to the right expert doctor, they will not waste your time also. They will tell you straight that, the problem is so severe that unless you do IVF or test your baby, or what we call ICSI, you will not become pregnant, and go straight to that treatment. And IVF treatment and ICSI treatment is excellent results nowadays. We typically say that if a person tries an IVF cycle 3 times, there is more than 90% chance of becoming pregnant. So every time you do IVF, there's about a 50-60% chance of becoming pregnant. There is no treatment in the world which is 100%. So, nobody can guarantee anything, So yeah. Treatments cannot be guaranteed, but let's put it this way, treatments are excellent,
Okay.
And you asked a very important question about egg freezing. And I'd like to highlight that a little bit, because there's a lot of conversation about egg freezing, especially since in America, Facebook and Google started paying their employees money to go and do egg freezing. And, because nowadays girls are getting married late.
Yeah.
Even if they get married on time, they want to pursue their career, they want to, you know, reach some place in life professionally, or for some reason, sometimes marriages break up, sometimes you're divorced, sometimes, you know, problems, we don't know what will happen in life. So sometimes there is a delay in planning your pregnancy, in which case time will not wait for anyone. After the age of 35, or in many patients much before that, the eggs can become very, very less. And we can test this with very simple tests, blood tests, sonography. We can actually count the number of small eggs in your ovary. So if you have eggs, we can give tablets, injections, we can make them grow. But if the eggs are very less, what are we going to do? So our advice is that if you're going to delay pregnancy for any reason, or if your eggs are becoming less, immediately take those eggs out and we can freeze them. And we freeze them at minus 196 degrees. Just to give you an example, a fridge is 0 degrees, freezer is 0 degrees.
Yes.
Okay, this is minus 196 degrees. So at liquid nitrogen temperatures, the eggs are frozen. Once you freeze the eggs, they remain in that quiet state for years and years and years. We have patients who have had their egg freezing done maybe 10 years ago, and they come back now and they put the embryos inside and they've had their babies. Sometimes people have IVF with us, they have a baby, then they disappear for 3-4 years. Then they come back when they want their second baby. And we take the same embryos which are frozen at the first IVF time and we put them inside and they can have their second baby. So egg freezing is very much recommended for the right patient. It's not like everybody has to freeze. So you have to seek advice. That's what my suggestion is, seek advice. Yes. Even if you're, for example, 32 years old, it's a good age. It's not like it's so old or something, but you may be 32 in age, but your biological age may be 38.
Yes.
You know, in which case then time is running out. So you may want to immediately freeze your eggs. So nowadays, because of professional reasons, social reasons, lots of people, even medical reasons. For example, I had a young girl, she was just married, and you know, they came for routine checks and she discovered that she had breast cancer at a young age in her 20s. So suddenly her whole life changed. And immediately we took her up for egg freezing, because if supposing this girl had had chemotherapy or radiation, her ovaries would have been completely damaged and her eggs would be finished. But because we took out the eggs and we froze them, she can go through her cancer treatment fully. And when she's well, she can come back and take out her eggs, fertilize them, and she can go ahead and have her baby. So for cancer, you know, survivors or people who are diagnosed with cancer. So there are many, many reasons for which egg freezing is a very good option.
Wow, this is a very, very you know, it's new and it's so much, it's so in depth and very interesting to know about these things as far as egg freezing is concerned, and the other treatments that you spoke about also. Doctor, my last question for today would be that, you know, on the topic of egg freezing, you know, is there a certain age bracket for women to kind of, you know, lock in their eggs at that time if they're looking to do egg freezing, and how effective is, you know, with your vast you know, amount of experience that you have, and you know, you've been seeing so many girls over so many years now, what is the success rate of you know, pregnancies that happen through egg freezing?
Yes. So like I said, there is no perfect age for egg freezing. It is individual, but 35 in our field is a cutoff. After the age of 35, the egg quality as well as quantity really goes down very rapidly. So if you're 37, 38, the eggs are going down literally every day. And not only the number of eggs, but the quality of eggs. So if a patient, for example, she can become pregnant even at 38, but there's a much higher risk of having babies with genetic problems such as Down syndrome. So we recommend that if you want to do egg freezing, try and do it before 35, if possible. If you can't, you can even come at 37, 38, anytime. You can freeze your eggs. If you have eggs, we can freeze them. It's better to freeze at 38 than at 42, right? So any age is a good age. But if there is awareness, if there is knowledge, I would recommend a slightly less than 35 age for freezing. Typically, it's a very standardized procedure again. And in fact, we were one of the first ones to bring egg freezing to India. We learned the technique in Japan many, many years ago. And that new technique really changed the way egg freezing is done. So now we do what is called vitrification, which gives excellent results For example, if you freeze 10 eggs, for example, and we like to freeze many eggs, 1 and 2 eggs really does not give good success. But if you freeze good number of eggs, then if you freeze 10 eggs, it's a possibility that when you recover them after 2 years, 3 years, 5 years, whenever you take them out, when you thaw them, you'll probably get 8 or 9 good eggs. So there's hardly any loss of eggs in this new technique of vitrification. Success rates again depends on the basic egg quality, the number. If you've frozen only 1 egg or 2 eggs, obviously later on also the chances of pregnancy are less, because I told you IVF is not 100% success chance that 1 egg is 1 embryo is 1 baby. No, you need more eggs and embryos. So if you're able to freeze good number of embryos or eggs, the chances are very high of your having a pregnancy later. There are almost no risks with the technique, almost no risk. I mean, any little procedure, even if you remove a nail, there's a risk in that. But risks are quite low. Yes, you have to take some injections for about 10 days to make many eggs, because we like to have many eggs. It's much more successful, the process, if we have many eggs. So that's about the only thing. And if we start the treatment from the period. So the day you get the period, we start the treatment. And in about 12, 13, 14 days, the treatment is over. So it's not like it's a long drawn out treatment, and you don't have to be in hospital except for half a day. Only the day when we're taking out the eggs, you come to the hospital, we take out the eggs, you go home in the evening. That's it. So it's not a very difficult or complicated procedure in that sense. There are good results. So obviously, we are going to select our patient. We're not going to say to everybody, just freeze your eggs, don't have your baby on time. Of course, have your baby on time. That's the best way to do that. Have your baby on time. But if circumstances are such that it is not possible, or it's becoming difficult, or you have some problems by which, like I said, some cancer diagnosis, or your eggs are getting over before time because you've done tests and you found that your ovarian reserve is low, then you should go ahead and freeze your eggs. That's the best insurance for you. So just like we do insurance for old age, you have to do insurance for fertility also sometimes. Yeah.
Thank you, doctor, for giving us so much information today. I have personally learned so much today on various new topics that are currently trending as far as gynecology and as far as fertility is concerned. Thank you again for being a part of this conversation. We are very, very happy to get somebody with the vast amount of experience that you have today on board, and to be able to talk to you, get answers from you, and get information from you, which will actually help a lot of young women today to get the right answers and to get the correct information. Thank you again, Dr. Rishma Pai.
Thank you. Thank you. I always like to be on a platform where I can share some knowledge and information, and hope that some women out there will benefit from this conversation. Thank you. Thank you so much.